This recorded lecture will be going over Chapter 4, the nursing process, critical thinking, and clinical judgment in the Fundamental Concepts and Skills for Nursing textbook. The nursing process is a way of thinking and acting based on the scientific method. The nursing process is a tool for identifying patients' problems or potential problems and an organized method for meeting patients' needs. The 5 components of the nursing process are assessment, data analysis and problem identification, planning, implementation, and evaluation. The goals of this systematic, dynamic process are to explore patients' health status, identify actual or potential healthcare problems, determine desired outcomes, deliver specific nursing interventions that will solve the problems and promote health, and to evaluate caregiving and determine whether the outcomes have been achieved. The clinical judgment model expands upon the nursing process and emphasizes the need to include context in planning patient care, as patient situations are dynamic in nature. The clinical judgment model includes the steps to recognize cues, analyze cues and form hypotheses, prioritize hypotheses, generate solutions, take action, and evaluate outcomes. Creating a patient care plan involves collaboration with the nurse, the patient, and the other health team members. Patient input during the planning stage results in greater success with the care plan and care coordination. The LPN assists with each part of the care plan. The LPN is often responsible for data collection to assist the RN with the assessment phase. The nursing process is similar to other methods used to organize tasks in daily life. It consists of assessment or data collection phase involving surveying the supplies on hand needed for food preparation. These data can be analyzed in order to analyze cues and prioritize hypotheses, to plan, to implement, and to evaluate. Evaluation is performed to determine whether the plan was successful. On page 51, within box 4.1, you can read a little bit more about components of the nursing process and the clinical judgment model, including data analysis and problem identification, also known as the nursing diagnosis. The planning stage, which is aimed at generating solutions. The implementation stage, which is aimed at taking action. And the evaluation stage, which is aimed at evaluating outcomes. The clinical judgment model can help a nurse develop good clinical reasoning skills that will result in solid clinical judgment. Critical means requiring careful judgment, and thinking in this context means to reason. Critical thinking is directed, purposeful mental activity by which you create and evaluate ideas, analyze data, anticipate problems, use expansive thinking, reflect on experience, construct plans, and determine desired outcomes. When we talk about critical thinking inside the clinical setting, we call it clinical reasoning. Critical thinking and clinical reasoning are needed to creatively problem solve and produce new ideas and solutions. Clinical judgment is the outcome of clinical reasoning, the conclusion or the decision that you will arrive at by exercising your clinical reasoning skills. Nursing is a discipline that incorporates scientific knowledge and research methods. To solve problems, scientists will use a consistent, logical method called the scientific method. A problem-solving process has the following steps. First, you define the problem clearly. Next, consider all possible alternative solutions to that problem. Then consider the possible outcomes for each alternative you have just created. Then predict the likelihood of each outcome occurring. Finally, choose the alternative with the best chance of success and the fewest undesirable outcomes. Decisions are necessary to solve problems. Good decision-making is choosing the best action to meet a desired goal, and it is part of the critical thinking process. Nurses often have to make quick decisions in moments of crisis. They also assist patients in making their decisions. Foundation skills are effective reading, effective writing, attentive listening, and effective communication. Reading a paragraph and then restating the main ideas to yourself is one way to read critically. Attentive listening means consciously focusing on the topic of discussion. You should pay attention to every word and the meaning that the speaker is trying to convey. Effective speaking will follow attentive listening. Take time to consider your response before beginning to speak. A technique that nursing students have found helpful to promote critical thinking is concept mapping. Concept mapping helps students learn to synthesize pertinent assessment data, develop comprehensive care plans, link nursing interventions with healthcare problems and problem statements or nursing diagnoses, and effectively implement their care plan. Concept mapping will help you collect data in a logical manner and then group those data in a meaningful way. Critical thinking in nursing requires skills and experience as well as knowledge. Critical thinking, clinical reasoning, and clinical judgment are all applied to the nursing process and the clinical judgment model in many ways. Assessment is carried out in an organized, systematic way. Data is collected by recognizing cues to determine and eliminate or manage actual or potential health problems. Data analysis and problem identification requires analysis of data collected during assessment by clustering related information, analyzing cues, identifying problem areas, and forming hypotheses. Next, you will prioritize those hypotheses. Planning involves generating solutions. This is determining specific interventions and desired outcomes for each problem statement and nursing diagnosis that you have formed. While planning interventions, consider ways to promote optimum wellness and independence, and the most efficient, cost-effective way to achieve these desired outcomes. Implementation is the process of taking action. This includes preparing and performing the interventions. Evaluation is the process of evaluating outcomes. This is carried out by collecting data to determine whether expected outcomes have been achieved. Critical thinking is used to set priorities for patient care. A priority is more important than something else at the time. Prioritizing will involve placing problem statements or nursing diagnoses or nursing interventions in an order of importance. Life-threatening problems are always of high priority. Problems that threaten health or coping ability are of medium priority. Low priority problems are ones that do not have any major effect on the person if they are not attended to that day or maybe even that week. Prioritizing patient problem statements is typically based on the adaptation of Maslow's hierarchy of needs. When prioritizing such tasks, you must consider what will happen if that task is not done on time. Other factors to consider are the surgery schedule, the stability of each patient, the amount of time needed to perform each task, availability of help, medication orders, unforeseen problems, and primary care provider making rounds. When all tasks have a rather high priority and there is no way that you can do them all alone, you must assign some tasks to others. Priorities will constantly change because patient needs and conditions are always changing frequently. To maintain organization with your workload, you must be flexible and frequently reorder your tasks. When considering the possible outcome of choosing each alternative, the nurse will look at the consequences of placing each patient first, second, or third. Considering the likelihood of each outcome occurring is the next step. The goal is to avoid having your clinical judgment cause injury to anyone. With critical thinking skills and clinical judgment, you can weigh many factors and skillfully solve problems, making good nursing care decisions most of the time. Operating in a critical thinking mode while pursuing your nursing studies will help you develop clinical judgment that is necessary for safe nursing practice.